Hello, we're going to be doing the tests for the hip and spine. First one is Trendelenburg's test, and the patient is going to be standing on one leg, on the affected leg, and if the hip will tilt a bit to the a bit down, so you'd see that the hip would tilt a bit this way, and this means that there's weakness in the gluteus medius. Okay, next we got the Thomas test, and for this one the position will be supine. And so for this one we're testing for hip flexor tightness, and I'm gonna raise the leg, and if the other leg, the one that's laying down, comes up and there's a gap under the knee, that means that the test is positive. Okay, next we're going to be doing the Candelas test, and similarly to this one the position is supine, and similarly to the Thomas test we're going to be testing for hip flexor tightness, except this one the legs, the lower legs of the person will be hanging down, and the person will pull the leg themselves. And if this leg lifts up, that proves that the test is positive. Okay. Next we have Ober's test. Position is going to be laying on the unaffected side, and here we're testing for the iliotibial tightness, and so he's going to be bent a little bit. I'm going to take one of the thighs and bring it back, and I'm going to lower it, and if the thigh doesn't fall, that proves that the test is positive. Okay, next we're going to have Renes test, and this one is position is standing. Here we're testing for tensor fascia lata weakness. Person is going to be standing on one leg, and they're going to bend their knee 30 degrees. And if there is pain in the lateral epicondyle, that indicates that the test is positive. Okay, next we have straight leg test. For the position, position is going to be supine, and we're testing for various things. It could be muscle tightness, it could be herniated discs, or even nerve damage. I'm gonna lift up the leg and make sure it's straight. And if there's any pain in below 30 degrees, that indicates that the person may have acute spondylolisthesis. And if the pain is anywhere between 30 and 70 degrees, this indicates that the person may have herniated discs between L4 and S1. And if the pain is in above 70 degrees, this indicates that they may have some hamstring muscle tightness. Okay, and lastly we have the Valsalva maneuver. This position is going to be sitting, and here we're testing for herniated discs in the lumbar area. So I'm going to ask the person to hold their breath and try to exhale, thus creating pressure in the spine. And if there's any pain in the lumbar area, that indicates that this is positive. And that's it. Thank you.